The complete head-to-toe nursing assessment. Every system, every step in the order that actually makes sense. Let's walk through it. Before you even touch the patient, there are a few things to handle first. Knock, introduce yourself, wash your hands, and provide privacy. Verify the client's identity and date of birth. Then do a quick orientation check. Ask their name, whether they know where they are, what month it is, and who the current president is. This tells you if they're oriented ×4, oriented to person, place, time, and situation. Before you assess anything else, know your normal ranges. Pulse, 60 to 100 beats per minute. Blood pressure, around 120/80. Oxygen saturation, 95 to 100%. Temperature, 97.8 to 99.1 degrees Fahrenheit. Respirations, 12 to 20 breaths per minute. Start at the head. Inspect and palpate the scalp and hair for any abnormalities. Move to the face and check for symmetry. To assess cranial nerve 7, have the patient raise their eyebrows, smile, frown, puff out their cheeks, and close their eyes tightly. For the eyes, inspect the external structures and check the color of the conjunctiva and sclera. Check pupils using PERRLA, pupils equal, round, and reactive to light and accommodation. And remember the pulse scale you'll use throughout the exam. 0 means absent, 1+ is diminished, 2+ is normal, 3+ is full, and 4+ is bounding. Moving down to the neck, chest, and heart. Inspect and palpate the neck. Check the carotid pulse and check skin turgor just under the clavicle. On the posterior chest, inspect and auscultate lung sounds, listening for any crackles or diminished breath sounds. On the anterior chest, note whether the patient is using accessory muscles to breathe, and check for symmetric chest expansion. Assess the depth of respirations. Is the effort labored or unlabored? Is the rhythm regular or irregular? For the heart, auscultate in 5 key areas: aortic, pulmonic, Erb's point, tricuspid, and mitral. Listen closely for any murmurs, whooshing sounds, bruits, or muffled heart sounds. Now the abdomen, and the order here really matters. Start by inspecting. Look at skin color, contour, any scars, and visible pulsations. Here's why the order is so important. You always inspect, then auscultate, then percuss, then palpate. If you percuss or palpate before you listen, you can actually change the bowel sounds and get an inaccurate assessment. Auscultate all 4 quadrants, starting in the right lower quadrant and moving clockwise. For bowel sounds, absent means you didn't hear anything for at least 5 minutes. Hypoactive is about 1 sound every 3 to 5 minutes. Normoctave is 5 to 30 sounds per minute, and hyperactive is 30 or more sounds per minute, sometimes loud enough to hear without even using a stethoscope. Next, the spine. Have the client stand up if they're able to. Inspect the skin on the back and check spinal curvature, cervical, thoracic, and lumbar. Palpate along the spine for any lesions, lumps, or abnormalities. Now the peripherals, starting with the upper extremities. Inspect and palpate for texture, lesions, temperature, moisture, tenderness, and swelling. Palpate the radial pulses bilaterally. Check the shoulders, elbows, hands, and fingers. Inspect, palpate, and assess. Have the patient grip your hands and check. Does each hand grip evenly? Moving to the lower extremities. Inspect skin coloration, any lesions, hair distribution, varicosities, and edema. Palpate for edema and note whether it's pitting or non-pitting. Check capillary refill time bilaterally. Normal is less than 2 to 3 seconds. Check the hips, knees, and ankles. Inspect and palpate each one. Check the dorsal pedis pulse bilaterally to assess circulation. Before you finish, run through your overall checklist. Did you position and drape the client appropriately, protecting their privacy? Did you give clear feedback and instructions throughout? Did you maintain a professional manner and treat the client with respect and dignity? And did your exam follow a logical sequence from head to toe without jumping around? And that's the complete head-to-toe assessment, every system, in the order that actually works. Follow at NCLEX with ZA for daily NCLEX practice questions to help you prepare with confidence. See you in the next video.